This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Hello and welcome to In Conversation With, a podcast from The Lancet Neurology. I'm Matthew Evans, an assistant editor for The Lancet, and I have been speaking with Dr. Alex Aranzo, a neurologist at the Hospital Clínic de Barcelona, who specialises on the effects of sleep disorders on neurological diseases. In this month's episode, Dr. Aranzo shares with us the association between sleep disorders and Parkinson's disease and the future for managing this condition. Hi, Alex. Welcome to the podcast. Thank you for coming on here. Please, could you introduce yourself and tell us a bit about your work?
Yes, this is Alex Aranzo. I'm from Barcelona, and I'm a neurologist and focus on sleep disorders that occur in patients with neurological diseases like Alzheimer's disease, Parkinson's disease, dementia with Lewy bodies, and so on. So mainly studying the sleep and sleep disorders in patients with neurological diseases.
And why should neurologists be concerned about the sleep quality of their patients? And why is sleep function particularly relevant in patients with Parkinson's disease?
Parkinson's disease is a very common condition in people over 60 years. And in patients with Parkinson's disease, let's call it now PD, they have a lot of problems. They have a lot of complaints, not only motor deficits and motor impairment, but also cognitive hallucinations, constipation, dysautonomic, and sleep. And sleep problems may occur during the course of the disease in about up to 80% of them. So it's really common. First, it's common, and second, that these problems in some patients are maybe cumbersome and bothersome, like, for example, insomnia or excessive daytime sleepiness, impairing their quality of life and their morbidity. So it's good to know about it because we can try to manage and improve and relieve the patients from these sleep problems and improve their quality of life. First of all, we have to identify them, identify them, and know how to diagnose them and treat them well, if we can, because it's challenging sometimes.
Of course, yeah. And in your review, you and your co-authors distinguished between sleep disorders that occur in the premotor phase of Parkinson's disease and sleep disorders that patients present after a clinical diagnosis of Parkinson's disease. Please, could you explain the rationale behind such differentiation and about the structure of your review?
Yeah, currently, still, Parkinson's disease is diagnosed by the presence of motor symptoms like slow movements, rigidity, and resting tremor. And this is how we, as a clinicians, make the diagnosis of Parkinson's disease. But we know that several years or even decades in some of these patients, most of these patients, they may present some other symptoms that we call the non-motor symptoms, like hyposmia, REM sleep behavior disorder, constipation, and depression that may occur before the onset of these motor symptoms. So this premotor or prodromal period or stage or phase, it's very interesting because the neurodegenerative process has started, the disease has started, but the motor deficits have not appeared clinically and have not impaired yet the patient. So this gives you a unique opportunity to identify in the population, in the general population, these people with prodromal Parkinson's disease. We have very good and reliable biomarkers and try to implement neuroprotective measures, which is it's a unique opportunity. It's like a holy grail to obtain or to identify one of these disorders. And regarding the sleep disorders, obviously REM sleep behavior disorder is the one. Is the condition, the disorder that in most of patients in the general population will develop this Parkinson disease or a related disorder like dementia with Lewy bodies. So that we separate the chapter between the premotor period, so before the Parkinson has started, and after the Parkinson has started. As we mentioned in our paper, is that these sleep disorders like insomnia, excessive daytime sleepiness, or disruption of the circadian rhythm, they increase in frequency and intensity over the time. So these three, insomnia, excessive daytime sleepiness, and circadian rhythm disorders, we will find in patients that already have been diagnosed with Parkinson's disease and early and late in the course of the disease, while REM behavior disorder predominates in the premotor period of the condition of Parkinson's disease.
You may have touched upon some of these, but what are the most frequent sleep disorders that precede motor symptoms?
It's only REM sleep behavior disorder. There are some information regarding the possibility of excessive daytime sleepiness or sleep apnea as a premotor feature of Parkinson's disease, but the evidence is not strong. But we have very strong evidence knowing that after 15 years of follow-up, most of the patients with idiopathic REM behavior disorder will be diagnosed by clinical means with Parkinson's disease or dementia with Lewy bodies, and in a very small frequency with multi-system atrophy. And we know this just following our patients in our clinical practice, but it's also very important that in 75% of these patients we can find a strong biomarker